The government made a big deal about recruiting foreign nurses to reduce the boiling pressure on the healthcare system. But CBC News confirmed at least 60 internationally educated nurses from India are waiting to get to work as registered nurses. Some have been waiting for a year. Nurses we spoke to didn't want to be interviewed. They fear jeopardizing that job promise. Thompson Phillips is a member of a local Indian community. He's a friend of some of the nurses and is their spokesman.
So these people have a nursing experience of 10 plus years. They're a little bit disappointed that they are not able to progress into the right position they were looking for.
The nurses were recruited to work as personal care attendants and were told by recruiters that if they got their Canadian nursing license, they can then apply to RN positions. But despite the headline about a nursing shortage, the health authority says there are limited vacancies in St. John's for registered nurse positions.
So that's the time frame. It's really meant as a help to plan and anticipate when you should see some opportunities become available.
Smith says that back in 2022, 375 IENs were recruited to work as personal care attendants, and this year, half are working as registered nurses. And there are plenty of empty nurse positions in rural communities, but that's not what these nurses from India signed up for.
We've talked about providing transportation to some of our rural sites so you could still have your home base within the city. We've talked and asked them what opportunities they would like to explore, a combination of efforts to meet their individual living and family goals.
After a year plus living in the city, moving to a small town is not appealing.
They're well settled in the city now. They've bought houses. Their kids are going to school. Their kids are going to university here.
The health authority says the nurses in waiting will land jobs in St. John's when they become available. It's just a matter of time. The nurses' union says that time is now.
The nurses working, and they're short-staffed. They're working overtime, 16, sometimes 24 hours. We were talking about possibility of a 24-hour shift at the Janeway last week. I've heard about private agency nurses working here in psychiatry. So don't tell me there's no vacancies in St. John's.
Coffee has a warning. The longer the international recruits wait for an RN job, the more likely the nurses recruited by Newfoundland and Labrador will be recruited by other provinces. And they are already calling. Arlette Lazarenko, CBC News, St. John's.